Shona Robison urged to come clean over stillbirth statistics. Giving a statement on the NHS Ayrshire and Arran maternity scandal at Holyrood in June, the Health Secretary said our stillbirth rates and neonatal death rates continue to decline. Ms. Robison also told MSPs and grieving parents in the public gallery we should welcome the fact that fewer families every year are experiencing the loss of a baby. Her claim was based on a report by the MBRRACE-UK pregnancy programme on stillbirth and neonatal deaths in Scotland in 2015. However, more comprehensive figures from the National Records of Scotland (NRS) show that both stillbirth and infant death rates rose in 2016. MBRRACE-UK recorded 191 stillbirths in 2015, a rate of 3.5 per thousand, while the NRS recorded 236 stillbirths in 2016, a rate of 4.3 per thousand. The preliminary NRS statistics were published in March, more than 3 months before Ms. Robison's statement. Meanwhile, it can also be revealed that MBRRACE-UK is using NHS records from Scottish maternity hospitals that exclude dozens of fatalities. The MBRRACE-UK programme was set up in 2013 and replaced annual Scottish reports on stillbirths and neonatal, newborn, deaths going back to 1977. At around the same time, the Healthcare Improvement Scotland Quango, which has close links to the SNP leadership, launched a drive to reduce mortality rates by 15%. Although the earlier reports always tallied with the NRS, the MBRRACE-UK reports do not, as they no longer include every stillbirth or neonatal death in Scotland. This is because the hospital records do not cover home births, some multiple births, and several health boards have submitted incomplete or late information. For example, NHS Lothian only completed records for 27.5% of stillbirths in its area between 2013 and 2016 compared to NRS. Despite the disparities between the two sets of figures, both NRS and MBRRACE-UK found that 2015 set a new record for stillbirths and neonatal deaths in Scotland. However, although the official figures from NRS rose again in 2016, Ms. Robison chose not to mention this most up-to-date information in her statement to MSPs. She said, "Our rates of stillbirth and neonatal death continue to decline." According to the MBRRACE report, in 2015 we had a record low rate for Scotland, and we are approaching the rates of the best-performing Scandinavian countries. Later, in a private meeting with campaigners and families, Chief Medical Officer Catherine Calderwood admitted that mortality rates had risen last year. NHS campaigner Rab Wilson, who was in that meeting, said, "Given the gravitas of the situation, the fatal errors that occurred at Ayrshire and Arran, and the publicity the story has received, you would think the minister would be really on the ball and have access to the most up-to-date and accurate figures." For Shona Robison to quote figures from 2015, when 2016 figures were available, seems suspicious at the very least, even more so when you become aware that 2016 were much more negative than 2015. It starts to look like an attempt to mislead Parliament. As Burns said, "Facts are chills that win a ding." These are numbers produced by the government themselves. They are there for everyone to read, and you'd think the person who should be most aware of them is the Health Secretary, so why are the wrong numbers being quoted? Scottish Conservative Shadow Health Secretary Miles Briggs said, "There's certainly an issue of accuracy here that needs to be cleared up as a matter of urgency. This is one of the most devastating things that can happen to a family, and it's imperative the Scottish Government treats information on this subject with respect." If this was indeed an honest mistake, Shona Robison should apologise to campaigners and set the record straight. A Scottish Government spokeswoman said, "Every case of stillbirth and neonatal death is a tragedy for all concerned, and it's vital that we learn lessons from each one." The 2016 NRS provisional data was published in March, but the MBRRACE 2015 data, published in June, gives a thorough analysis of stillbirth rates which identifies board-level good practice and areas where improvements are needed. Stillbirth rates have reduced across Scotland by 19% over the last 10 years, but regardless of which statistical source, we remain committed to doing all we can to reduce rates still further.